So maybe you notice you clench your jaw a lot. It could happen in your sleep or in a tense situation, and maybe without even realizing it, back pain starts coming on and the two are connected. And usually we don't know anything about that connection. Have you ever wondered what jaw tension might be doing to the rest of your body? So what if I told you your bite could well be contributing to lower back pain? I'm Dr. Melanie Carlo, and welcome back to Why It Hurts and How to Heal. Before we begin, the usual. Help out a gal, like the video, subscribe to the channel, and let me know in the comments about your experience of tension in your jaw and your back or both. Hopefully by the end of this video, you're going to see the connection. So when clients come to me with chronic low back pain, most physical therapists start by looking at the spine or the hips, and that makes total sense. But there's something I never try to overlook, and that is the jaw. I notice how people are sitting, if their jaw's moving a lot, if there's a sense of tension. Because in somatic healing, what we know is the body never operates in isolated parts. It moves and it compensates and it learns as a system, as a whole. And our traditional medicine tends to break things into parts, and it's just not right. The jaw and the pelvis are actually connected through what's called the deep front line. And this comes from the beautiful work of Thomas Myers. And he has a book called The Anatomy Train. And this is an image of the deep front line. And you can see it goes from the jaw through the neck into the rib cage. And this is deep in the viscera. If you were to take the abdominal contents out, this runs. Look at the muscles on the front of your spine. Deep, the psoas, which a lot of us know about, deep into the adductors and the perineal muscles at the lower base of the spine, all the way down deep into the legs and deep into the foot. It is an incredible kind of superhighway, a fascial highway that runs basically from the tongue and jaw all the way to the inner thighs. And so in Thomas's awesome book, Anatomy Trains, there's a beautiful poem that I want to read about this. Let's see if this moves you like it did me. This talks about the deep inner line as like this structural tent in our body. She is, as in a field, a silken tent at midday when a sunny summer breeze has dried the dew and all its ropes relent, so that in guise it gently sways at ease, and its supporting central cedar pole that is its pinnacle to heavenward and signifies the sureness of the soul, seems to owe naught to any single cord, but strictly held by none, is loosely bound by countless silken ties of love and thought to everything on earth the compass round. And only by one's going slightly taut in the capriciousness of summer air is of the slightest bondage made aware. That's a sonnet from Robert Frost. So let's think about that for a minute. What causes a single line to become taut that then affects the whole of that system? Well, we're made up of body, mind, and emotions. And those are all distinct layers of the nervous system and of our consciousness. And then there's an arching consciousness over that. That's our awareness. And I'm so inspired to do a video I'm going to do after this on a meditation for that. That may be something you can bring into your day. Start to become more aware of these different levels. So over time, if there's been an injury, sometimes dental injuries to the jaw, holding your mouth open for long dental procedures is a terrible idea. Ask your dentist for bite blocks, little round things they can put in the back of your jaw so you can hold it quiet. And I'm actually going to show you a little exercise with that. Jaw blocks, long dental procedures can cause terrible havoc. Injuries in the neck, having to close your mouth during tense situations because it's not your time to talk or you're not allowed to give voice to something. The emotions around that can cause protectors in the jaw because it's just trying to help you. The mind causing us to tighten and tense in the jaws. All of these add layers to the nervous system that over time lock that central line. And remember, it connects from the jaw all the way down to your back. So you can actually lock your back into a chronic discomfort, especially in the lower lumbar region, with tension in the jaw. So somatic healing teaches us that tension isn't just muscular. It's a protective response from your nervous system that involves the mind, the emotions, and the body. So your jaw might be clenching because your nervous system's actually trying to feel safe again. And the clenched jaw is often like a body-wide alarm system letting you know something's up, because so much is attached. I mean, we eat every day. There's so much going on in the jaw. It's really important to pay attention here. And the clues can be subtle, and they should not be painful. At this point, that is where we're going. So when we bring safety and awareness into the body, especially in the face and in the pelvis, we create an opportunity for the entire spine along that deep fascial line to soften and reorganize. All right, let's do a quick somatic reset. Several of them that you can do anywhere. We're going to do the jaw, the pelvis, and the breath. So for jaw softening, gently place your fingers just in front of your ears, and you'll feel a little divot there. That is your temporomandibular joint. So I want you to slowly open and close your mouth. And as you do it, notice what you feel. Does one side move more than the other? Is one more prominent under a finger than the other? Don't judge it, just notice. Imagine your jaw moving more like a hinge, not a clamp. Soften the tongue to the floor of your mouth with the space behind your molars open slightly, quietly. Okay. Now, this is a really interesting thing that you can do. I used to run a headache clinic at Bethesda Naval Hospital, and this is something that I taught people. So get a pencil, right? Pencils are good because they're wood, they're soft, and cut off about a bite-sized piece of that pencil. And you're not going to grind on this. Make sure it's a non-toxic pencil. You're going to put it in the back molars between the top and the bottom, as far back as you can go. If you're missing a tooth, just come forward. Back molars. And I'm going to put it there, and then I'm going to gently bite down, which changes the angle of the bite with my fingers back in the ear area. I'm going to do 3 slow bite on, count of 5, bite off, count of 5, and feel inside that ear area. Okay? Get in there. All right. 1, 2, 3, 4, 5. And let go. 5, 4, 3, 2, 1. Sounds fun. Again. 3, 4, 5. Soft. Let go. 5, 2, 1. Take it out so you can hear me. And the last time, very gently, bite down. 1, 2, 3, 4, 5. Softly notice the hinge and let go. 5, 4, 3, 2, 1. Now go ahead and take that out. Let your teeth come softly together and feel the difference. There's a different angle to your bite now because you use these strong masseter muscles in a different way. And now once again, open and close. Just be aware, don't try to change it, don't judge it. Don't need to go open wide. If your jaw bothers you and you're having pain in your TMJ, try to keep your mouth not opening any more than 2 fingers until it heals. When you open too far, it can tend to dislocate, and there's a little disc there that can get out of place, and man, does that hurt. All right, so gentle to the jaws. Rub your hands together. Get that warmth, and just thank this jaw. Put your hands there and thank it. Deep breath in the low back. Let it go. All right, let's do a pelvis check-in. So once your feet on the floor, sit down if you're not sitting already, if you can. Sit down and move to the front of your sit bones, right? Sit bones, the ischium. The base of your spine, the inward curve here, is these 2 bones, the sit bones, and the sacrum, which is the fused triangle bone in between. That's what we're going to work with because the muscles of the deep line run in here. So we're going to play with those now, okay? So sitting on the front of the sit bones, feet flat, knees soft. So let your fingers be on your jaw. And let your jaw relax again and bring awareness to the sit bone. And without forcing it, inhale and tip the sacrum forward. Keep your jaw relaxed, front of the sit bones. And then on the exhale, breathing in the low back ribs first. Exhale, tip it backwards. Off to the back of the sit bones. And inhale forward. Keep letting your jaw, your warm hands hold a safety and a quiet. Exhale, back of the sit bones. Pull your belly button in, roll to the back. Feel, keep going, almost like a gentle unzipping kind of sensation from your jaw all the way down to your sit bones. Notice the connection or just make it up because fake it till you make it actually works. They are connected. Very slowly. And now we're going to bring the breath in because it's already here. So you're inhaling, the breath starts at the base of the pelvis, rocking forward, low back ribs, and rises to the roof of the mouth. And this time when you exhale, let a soft go through your parted lips. Let your jaw be even quieter in your hands. Let the breath fall to the back of the throat towards the belly. Inhale, rock to the front. Exhale, soft jaw. 2 more times. Inhaling. You can let your hands down if they're tired. Just stay tuned in and notice if there's any emotion, peace, irritation, frustration, fear, anything. Just notice, let it be there without judgment. Exhale back. And now stop. Let your eyes softly close and tune into the breath. Tune into the feel of the breath in the body. You may notice a gentle rocking naturally that may not have been there before when you breathe in. Breath brings you more to the front of the body, curves the low back in. Exhale brings you more to the back. And the jaw can remain relaxed. And just tune into your back and your jaw. Do they feel different? If your jaw and your spine have been locked in a silent battle for years, it's time to reintroduce them to each other with compassion. And it's not about fixing it. It's about feeling it and allowing healing to come in. I'm totally inspired to do a meditation to bridge these 3 layers of our awareness, the body, the mind, and the emotions, which all make up our consciousness and make up the protector. And when the protector's in charge, it's strong. It's a primitive reflex. It takes over. But as you bring more gentle awareness to the separation between each of these and start to give the protector the rightful place that it should have, thanking it, but letting it free of that hard task of always tensing, something really magical happens. So check that meditation out. It could be a daily practice that keeps going inside you and helps shift these layers, learning how to have fun in there, as my son would say. So, thank you. Let me know in the comments if you tried this release and what you noticed. And if you want more body-to-body connection tips like this, subscribe, stay tuned, because it just keeps rolling out over here. This has been so much fun. Thank you.